everyone. Today I'm presenting a case of traumatic lens subluxation forming a subconjunctival bleb, which is one of a very rare ocular sequela of blunt trauma. It's not moving. So, ocular trauma resulting in subluxation of crystalline lens into the subconjunctival space is a very exceedingly rare occurrence. Thus, we are reporting this case. A 30-year-old unattended male was brought to OPD with complaints of redness, pain, and diminution of vision in left eye since 10 days after fall down from stairs, directly hitting to his left eye. On examination, his right eye was normal, vision was 6/6, near vision was N6, and his left eye vision was hand movements PL plus PR4 plus. On slit lamp examination, here we could see a supranasal subconjunctival bleb containing the subluxated lens was present with the updrawn pupil, hyphema was present, and pigmented vitreous was present in the anterior chamber. This was his gross appearance. Investigations were conducted. Left eye B scan was suggestive of subluxated lens anteriorly into the subconjunctival space, and vitreous hemorrhage was present posteriorly. His X-ray orbit was within normal limits. Now we did a surgical management. First, we did a conjunctival peritomy at the site of subluxated lens. Limbal tear was noted from 10 o'clock to 1 o'clock. Here we found that the cataract, actually matured while being in the subconjunctival space for the 10 days. Thus, the lens matter was removed from the subconjunctival space and its capsule was then excised. After which, 7 limbal sutures were taken and adjacent conjunctiva was reposited. Post-operatively, patient was started on topical steroids, antibiotics, and anti-glaucoma medications. After discharge, patient was unfortunately lost to follow-up. The mechanism in this case most likely involves the zonular dehiscence combined with the limbal perforation, allowing the lens actually dislocation into the subconjunctival space. Now, blunt trauma causes sudden anteroposterior compression and equatorial expansion of the globe, which can lead to the zonular rupture and posterior segment complications like vitreous hemorrhage, retinal detachment, etc. Imaging modalities like B-scan or anterior segment OCT can be helpful for delineating position of lens and integrity of the lens capsule. Open globe injuries require timely intervention and staged procedures for optimal visual outcome. Here, as we have done, primary management requires wound exploration and repair, whereas secondary management can be planned with scleral fixated glued IOL or iris fixated IOL or even anterior segment IOLs when the posterior segment is normal. In conclusion, ocular trauma can have a very dreaded anterior and posterior manifestations, and timely and staged procedures should be done for optimal visual outcomes of patients. These are my references.